everybody, it's Dr. Magnifico from Vet and Probably.com. This is Buttons. Buttons is about 6 months old. We just spayed her. For today's spay, we did a couple things. Every time a cat comes in, we do a physical exam. We make sure we review with the client what they want to do. She got her kitten vaccines, which is rabies and then a feline leukemia BRCP combo. She also got microchips. This is our microchip scanner. And there's her microchip, so that was done. We also did her nails. It's important to talk to your vet about doing nails if you want them done while your cat's under anesthesia. That's Stella who's talking. She's just waking up from her spay. We certainly go over things about go home, so I'm gonna, I always want people to check the incision. This is her spay incision, so it's very small. There's a little bit of swelling because she has a little bit of sub-Q fat. Make sure you're very comfortable with that. Talk to your vet about things like post-op analgesia. Honestly, the very young cats who, come in for the spay, they do very well, and typically we don't send them home with analgesia, but that's something to talk to your vet about. And then talk to them about keeping your cat inside and quiet for at least 2 weeks so that they can heal nicely. I want people to check the incision daily. For those cats who are, indoor, outdoor, we talk about flea prevention and the importance of intestinal parasite checks. And then if you have any questions or concerns, make sure you follow up with your vet right away. Typically cats, especially the young cats, will recover within a couple of hours. So I really expect them to be completely normal by 24 hours or at least the next day. If that's not the case with your cat, please talk to your vet. One of the important things to do is understand heart rate, respiratory rate, temperature, and then gum color. So those are the things that your vet's going to check if you come in for any post-op questions. So gum color, you want to make sure they're nice and pink. So she is nice and pink. And then, her overall attitude that she's calm, she's quiet, she's interactive, she seems comfortable. If she's sitting and hiding in the corner, typically that means that she's in pain. Cats are somewhat difficult because they're very subtle with their clues, but I really expect that night they're pretty quiet. Don't be afraid to put them in a crate or a small room, and by the next morning they're acting completely normal. If they're not completely normal the next day, see your vet ASAP and look for any signs of infection at the surgery site. So that's pain, swelling, heat, inflammation, and any kind of abnormal discharge. There really shouldn't be any. Cats, for whatever reason, will get some swelling, scar tissue swelling, and that's something to go with your vet to make sure that it's not infection, it's just normal post-op swelling. If you have any questions, you can reach me anytime at Vet or Probably.com. Take care.